Okay, so with me is Dr. Abhi, and he is asking that still he is not able to figure it out or understand that why we apply 80% of the total PEEP or 80% of the auto PEEP, more or less they come same. Why we apply in COPD patients to keep the airway patent in a spontaneously breathing patient? Because application of the PEEP, he feels that dynamic hyperinflation will worsen and it will compromise the airways. So let's try to understand that. Now the whole respiratory tree is divided into 23 zones for that matter. So one part is the conducting part where the air is getting conducted but no gaseous exchange is happening, and the other part is the gaseous exchange area where the oxygen diffusion and carbon dioxide diffusion takes place. So it is divided into 23 zones. So the one is your trachea, starting from trachea, then you have main bronchus, then you have segmental bronchi, then subsegmental bronchi. Till subsegmental bronchi, you have cartilaginous ring in the tracheal tree, so they prevent them from collapse during inhalation and also during exhalation, most importantly. And now below subsegmental bronchi, you start with bronchioles. So bronchioles don't have a below this means below bronchioles that you don't have a cartilaginous ring. So the patency of these bronchioles is dependent upon the traction by the surrounding structures. So then subsegmental bronchi, bronchioles and terminal bronchioles. So till terminal bronchioles you don't have gaseous exchange, everything is conducting. And below this you have transition bronchioles, which also called respiratory bronchioles. One or two alveoli are sprouting out of it. Then you have alveolar ducts, means acinar ducts, and then you have alveolar sac. So respiratory bronchioles, acinar ducts, and alveolar sacs. Here the gaseous exchange occurs. Now what happens? Understand that the parenchyma, if your respiratory bronchioles or alveolar sacs get collapsed, you need to apply the PEEP, obviously, to keep them patent open at the end of expiration. But in COPD, what happens? The pathology is at the level of the bronchioles, terminal bronchioles, and in advanced disease at the level when the cartilage get damaged, the upper airway also. So what happens during active exhalation? Because of the surrounding force, there is no cartilage, they get collapsed. So to maintain the patency of those collapsed airways, those your terminal bronchioles and bronchioles, you need an application of the external PEEP, which we apply 80% of that PEEP to remain them open during exhalations. So I hope this clarifies. Do read more about it.